Okay, good morning, folks. Welcome to Care Options, a residential placement. My name is Amy Abrams, and I am the Director of Education at Alzheimer's San Diego. Very pleased today to be co-presenting this information with my colleague here in the Education Department and a member of our Clinical Services team, Jean Alton. Welcome, Jean.
All right, good morning, everybody.
We are also joined today by Kristen, who is a social worker and a member of our clinical services team. Hi, Kristen. Happy to have you with us.
Hi, everyone. Thanks for having me.
So here is our overall agenda, our program here today. I'm going to start talking about long-term care very broadly and generally, what it is, because the term itself causes some confusion. Jean will then describe the range of residential care options that are available nationwide, but specifically we're going to focus on what the landscape looks like here in San Diego County. We're going to talk about the various types of other support that folks might need when they are looking into residential care, planning a move into residential care, or making that transition into residential care. And then finally, we'll cover the important topic of how people pay for this in terms of private payment options, as well as benefits that are available to folks who don't have private resources to pay for long-term care. We will make sure that you know about the resources and support that are available through Alzheimer's San Diego and, of course, elsewhere in the community too. So first, we'll start talking about what long-term care is. And I just want to acknowledge, if any of you attended last week's program, Care Options is a two-part webinar, but you don't have to attend both sessions. They stand alone, they're independent. But if you did attend last week's Care Options program that was focused on in-home and community-based resources, some of this will be a brief review, but it's a short section. So don't give up on us. It's not the same program. So to clarify, to explain the term long-term care, it's a bit of a misnomer in a couple of respects. I think because it includes the words long-term, it sort of implies that you need to use long-term care services for a long period of time. This is not true. One can use long-term care services for even just a short time. This is the term that we use for this range of services, supports, care settings, where people receive assistance with the non-medical or custodial types of care. That means help with the activities of daily living. That's an insurance term, ADLs, but it is something that you'll hear a lot about as you are exploring in-home care, community-based services, residential care options, or experiencing a stay in a skilled nursing facility. The ADLs are what long-term care is all about. So sometimes we define long-term care as that which is not healthcare. So we all, most of us have, through Medicare or other types of private health insurance, we have insurance that helps us cover the cost of medical care, health care, skilled care that is provided by a licensed person, that is either provided by or prescribed by a physician. That's our healthcare system. That's how that generally works. Staying in a hospital, having an appointment with a primary care or a specialist, for example, receiving in-home licensed home health nursing services, right? Those are examples of medical care. Those are covered by primarily, at least mostly, by traditional forms of health insurance or Medicare. Long-term care is everything else. All of these custodial services that help people with what we call the activities of daily living: eating, bathing, so that's either in a bath or a shower, or even a bed bath, getting dressed, doing personal hygiene, right? Combing your hair, brushing your teeth, transferring, which refers to being able to move from a lying to seated or a seated to standing position, toileting or managing one's continence, and mobility, walking or moving around in other types of ways. These are what we refer to as those ADLs, and long-term care refers to those places, those types of services that provide help with those things. Long-term care is not always provided by a professional, by the way. It's not always provided in a specific place. Families and friends and neighbors and community groups, right? They are really the natural supports who provide the bulk of long-term care here in our system in the United States, right? They're not paid anything, or they might be, but they're not formally paid anything. So long-term care refers to that whole spectrum of informal friends and family, paid professionals, and settings, physical places that provide all of these things. Long-term care is not covered by Medicare and other forms of traditional health insurance, again, and we will emphasize that point heavily here today. So what you see in that blue bar there, if you're able to see that, is what we refer to sometimes as the continuum of long-term care. Again, continuum can be a little bit of a misnomer because you don't necessarily move from one level to the next, but it does kind of generally describe a range of supports and services that move from the least intensive types of care to the most intensive. So there's in-home care and adult day programs. Those were covered in last week's webinar on care topics, care options, living at home. That webinar is currently, a recording of it is currently available in our webinar library if you wish to go back and learn more about that side of the continuum of long-term care services. What we're going to focus on today is residential care, which board and care, assisted living, and memory care are types of residential care, and skilled nursing care. So before we do that, just a sort of pause to reflect, right? Is it time for more help, right? This is in my career supporting people who are living with dementia and their care partners, both here at Alzheimer's San Diego and in my previous life as a private care manager. This was probably the question I helped people work through, wrestle with, answer the most often. I know that this range of services and support is out there. Is it really time yet? Would it be overkill, right? Am I making a move too soon? So here are some of the sort of questions or thinking points or talking points, conversational points we would like you to sort of explore when you're considering, is it time to bring in some help? Or if you're at a particular level of care right now, is it time to sort of bump that up and bring in more support or move to a more intensive level of support? Is it time? Are you having a hard time managing your roles and responsibilities? If you are either a recipient of care or if you are a care partner to someone else, are the physical needs, the custodial needs, remember those things that were on that graphic that I showed you, help with getting dressed, help with bathing, but also the non-ADL things that are also a part of life, grocery shopping, medication safety and medication management. If you have pets, right, who's helping to walk and take care of those pets? If all of that other stuff of life is making it harder for you to engage in the normal sort of roles and responsibilities that are important in your life, to spend time with people who are important to you, to engage in the work or volunteer or recreational activities that are important to you. If you're struggling to participate in those roles that are traditional for you, it might be time to bring in some more help. If the caregiver is beginning to experience negative health effects, this could take many forms. I think that the most common health problems that we see in people who are caring for someone with dementia is a lack of sleep or a lack of quality sleep, which has significant detrimental health effects in the short run as well as in the long run. And also blood pressure. We do see a lot of hypertension in dementia caregivers in particular. But whatever the specific thing might be, more aches and pains, an exacerbation of mental health issues, an exacerbation of other types of physical health issues, If it's just been a really long time since, maybe you have a chronic condition and because of your roles and responsibilities as a caregiver, you're not able to get to your own doctor to sort of stay on top of those things and manage them. This, I hope, will be, this is a red flag, and I hope that this will be a wake-up call to anybody who finds themselves right now in that situation. What we don't want to see is you burning the candle at both ends, right? As a care partner trying to support somebody who's living with dementia, and then you end up having a health crisis. Then you both are in need of support, right? So if you are experiencing the negative effects of being a care partner or caregiver to somebody who's living with dementia, it is time for some more help. If the person living with dementia is experiencing new and challenging changes to their behavior, changes to their personality that are making it hard for you to sort of predict how to support them, learning those strategies and finding ways to redirect, to calm them down if they become agitated, for example, or redirect agitated behavior. If you're finding that those changes are just sort of beyond what you're able to manage, and they are for many people, then it is time for more help. If the person's personal care needs have sort of progressed to a place that you aren't able to meet them because maybe physically you're not able to help with transferring, especially for care partners who are physically smaller or less strong than the person that they're caring for. This issue comes up even earlier for them. But even very strong, healthy caregivers can really struggle with being able to provide physical care to a person who's living with dementia. It is not like childcare, right? You are trying to provide help to a full-grown adult who in all likelihood doesn't really want your assistance, right? This takes a lot of skill, this takes a lot of finesse, and in a lot of cases, it takes a lot of physical strength that a lot of care partners do not have. There's also just the reality of the discomfort at providing personal care. I might be able to help my loved one with toileting or bathing or getting dressed, but do I want to? Do they want me to do that? Are they comfortable with that? And if that's a line in the sand for you or for the person that you care for, that's a perfectly acceptable line. And then, of course, there's the safety issues that we have to keep in mind. If you are not able to prevent somebody from falling and injuring themselves regularly in the home environment, for example, if they're getting hurt due to medication mistakes, or they're cooking independently and leaving the stove on and potentially causing a fire risk, for example. And of course, if they are wandering, if they've gotten lost, everybody with dementia is at risk of wandering, of getting lost, regardless of how mobile they are, regardless of what stage of the disease they are in. And if that's already happened once, it's very likely to happen again. If it hasn't happened once, it's still very likely to happen. It's a very high risk behavior in people with dementia. It's very common behavior. So if those safety concerns have become hard for you to manage, then yes, it is time for more help. And something that I always like to point out is if you saw the title of this webinar on our calendar, you got the announcement about it and you signed up and you logged in this morning and decided to spend your morning with us learning about this, then I would say that to me is an indication that it is or it will soon be time for more help. So I'm going to turn things over to Jean. Jean, I'm going to give you the remote control here.
Good, thank you.
Hopefully.
We'll see if it's going to work for me
Yeah.
today. And before I get into the details here, I just will, kind of join forces here with Amy and saying and agreeing with her on all these points about if you're here, that probably indicates that, it is time to start making these plans and looking at options. And let me tell you, and I know Amy will agree with this, and I know Kristen will as well, is how many times we talk with family members, with care partners who are having to, in a crisis moment, examine and make decisions regarding residential placement. And that is just so stressful and it's so hard. So don't wait until that moment happens for you. I hope it doesn't. Start thinking, start planning ahead. folks and kind of get your research done and get your quote unquote ducks in a row so that you can move forward with this whole business of placing someone you care about and love in a residential setting, and doing it carefully and thoughtfully, and just kind of with attention to yourself as well as your person living with dementia. So it's just, that's what we hope for all of you who are looking at these options. So come on. There we go. Was that me? I think it was, by George. So we're going to talk about the continuum of residential care, and we're going to talk about a variety of different residential environments that are out there and what they are and what the differences are between them. And there are many, and you'll hear some different terms. We're going to give all of those to you as we go along. Don't feel like you have to remember all of this right here at the moment, because again, you'll get the copy of the slides so you can go back and refresh your memory with regards to the language that we use. So this continuum of residential care covers kind of from the least amount of care that is involved, in other words, the greatest independence, which would be these independent living and senior communities, all the way through to residential care facilities for the elderly, which encompasses about 3 different kind of areas that we'll talk about. There's skilled nursing facilities, and then the one at the bottom of this chart here that you see is called a continuing care retirement community. So all sorts of different terms and language used here, and we'll get into it a little bit to give you some more details. So we'll start with the independent living and senior communities. And so these are, gosh, we see these all over San Diego County. And they are simply, as it's stated, they are senior communities that have been formed for people. Oftentimes it's at age 55 plus. And they don't provide any level of care. So this is for people who live independently, couples who live independently, and other family units that live independently. They're generally speaking, I mean, these are folks who will have some of the typical concerns and challenges of growing older. And so there may be people with mobility concerns. There may be people with cognitive impairment. There may be people with other types of medical issues. But these are basically like apartments and condos in a senior community. So people are taking care of themselves. They are independent. And, there's no licensing and there's no provisions for care, for example, with your ADLs, as Amy had talked about earlier. And, they may have, the clubhouses and the game rooms and all of those different kind of supportive services, supportive in terms of leisure and organization and socialization, but that's what it's restricted to. You don't get any further assistance than that in these types of communities. So, and then, come on. There we go. Oops, I have to go back one. I apologize. There we go. Residential care facilities for the elderly. All right, here's where we really start getting into the meat of things. So the 3 areas that fall under RCFEs, you'll hear professionals talk about these care facilities as RCFEs, are board and care facilities, assisted living facilities, and dementia and memory care facilities. Okay, so those are the 3 areas here that come under the residential care facilities for the elderly. All of these types of facilities are licensed. They are non-medical, as Amy had talked earlier. So remember, remember that, that's really important. Non-medical, but they are still providing some very comprehensive custodial care, which means, in a nutshell, that they are attending to those ADLs. They are helping people with bathing, with toileting, with dressing, with mobility, these types of things as it is needed. So when we break things down, you'll see at the bottom, the average cost of assisted living in California, this is a 2020 figure, is about $5,000 a month. So not inexpensive. And I want to break it down a little bit more for you. So the board-in cares are, generally speaking, the smaller private homes in your neighborhood. And I often say this in this class, we've got one just 2 houses down from us, a board-in care. So the house is very similar to ours, and it is a board-in care. So they have, I believe it's 6 residents that are living there with staff. And the staff are, of course, taking care of those ADLs, helping people with all those things they need to do to have a bath, to use the toilet, to get dressed, to do grooming, all these different types of things these folks that live down the street from me are receiving from the staff. The board-in cares can cost a little bit less in terms of pricing than the $5,000, although there's plenty of them that would be $5,000 a month too. But I'm going to give you the figure in the range of, you can maybe find a board-in care that's maybe in the $2,500 to $3,500 a month range. Assisted living facilities are, of course, again, still licensed, non-medical care, helping with those ADLs, okay? But assisted livings are not locked and secured in any way. And they do tend to be a little bit larger. This is not like the home down the street from me. Assisted living might have 30 residents living there, maybe 45, and sometimes bigger than that. What is different for an assisted living facility is they are usually also providing some extra services, in the sense of having dedicated staff that help with activities. So they may have a activity program for the residents. They may have transportation, a bus that takes residents on outings and or potentially to doctor's appointments. So there's just some extra services that families and people residing in assisted living are receiving that is more than what you would generally find within a board-in care facility. So again, as we mentioned here, the average cost would be about $5,000 a month for assisted living. But remember, that's just an average. The range could be anywhere from, maybe $4,000. You might be able to find one maybe for $3,800 a month on up from there, and beyond $5,000 a month. Memory care, dementia and memory care is a type of assisted living, but it is specialized for people with a diagnosis of some type of dementia who have cognitive impairment. How is it different? Well, it has a higher requirement level in terms of licensing. And what that means is a memory care facility must have a delayed egress system in their memory care section of the facility. And by that, I mean a secured perimeter, so that the people living in that particular memory care area are not able to leave, at least not unknowingly leave the site. And the reason for that is going back to some of the safety concerns Amy talked about, primarily of which is wandering. So the memory care facilities have these secured perimeters, also called delayed egress. This is where you maybe punch in the code in order to not only enter into the memory care facility, but also to exit from it. So it's delayed egress. They are also required to have what is, as per licensing, called sufficient staff to meet the needs of the residents. And so this, generally speaking, would translate into a bit higher staff ratio. Now, the reason the language is kind of vague there, what does sufficient staff mean? Well, the example is if, I say I'm running a memory care community right now, and the residents that I have in this community are actually, they have dementia and cognitive impairment, but they're still, fairly high functioning. So in that instance, my staff might be a little bit lighter in terms of numbers than if I had a population of people in that dementia care unit who were requiring more care and supervision because of disease progression. Then my staffing levels would go up. So they must have sufficient staff to meet the needs of the residents. The other thing is that the staff is required to receive dementia care training when they are hired, and then again on an annual basis. So, and training that is specific to people who are living with a diagnosis of some type of dementia. So it's those three things that are different for dementia and memory care, that are different from board and care and assisted living. That they have the delayed egress system, which means the secured perimeter, that they have sufficient staff to meet the needs of the residents that are currently residing there, and that the staff receive onboarding dementia care training and ongoing dementia care training. The costs for memory care are higher on average than assisted living, and can range really from, $6,000 and on up. It might be as much as, I know for sure there's facilities here in San Diego County, it might be $9,000, $10,000. And it's usually, the fee structure is based on kind of the add-ons. The more care a person is needing, that that is adding on more costs for their care. So then let's move along here to the next section. Lots of detailed information, I know. These are the skilled nursing facilities. And so you'll see in the brackets afterwards, SNF, and what you'll hear people like myself and Amy and Kristen referring to with skilled nursing facilities, they get called SNFs. So just be aware if you hear SNF, a health professional talking to you about placement, and they reference a SNF, that's what it is, a skilled nursing facility. So what do these places have going on? Well, just look at the name, skilled nursing. So these are facilities that people reside in where there is not only assistance with those ADLs that we have talked about, which is the non-medical custodial care, but there's also assistance with the medical needs of people. And so there on staff will be nurses. There's likely to be actually a doctor on staff, therapists, nursing assistants, physical therapists, occupational therapists, all sorts of other medical professionals that are there to assist in the medical care needs of the person. These types of facilities are licensed and regulated by the California Department of Public Health. And generally speaking, the cost of care for these particular facilities, SNFs, is going to be about $376 a day for a private room. Now, how do people get into a skilled nursing facility? Well, generally speaking, if a person needs, let's say, for example, has been in the hospital and has had a surgery, perhaps to repair a broken hip, or is recovering from, let's say, a stroke. Oftentimes, upon discharge from the hospital, the person is discharged to a skilled nursing facility so that they can receive some short-term care for rehabilitation, to receive that physical therapy and those other ancillary services and therapies that will help them to recover. The other kind of pathway that people may come into a skilled nursing facility is if they have Medi-Cal, qualify for Medi-Cal, which we'll talk about in a little bit, and are needing that long-term care and that assistance with ADLs. And so for folks that have Medi-Cal and need that long-term care, this is where they may come into a skilled nursing facility to receive that and have it covered by Medi-Cal. We will be talking a little later on about the financial end of things. So we will be addressing Medi-Cal as well too. So then we have the continuing care retirement communities. And there's a few of these around San Diego County as well too. And these are communities that kind of encompass all the levels you see, up high here on the chart. So a continuing care community will likely have an independent living area, for seniors to just have apartments and condos and kind of do their thing. And then they're likely to have these RCFEs as well too. So they may have an assisted living section of the community. And in addition to an assisted living section, have a memory care section of the community. They are also likely to have a SNF on site, a skilled nursing facility, which is often just called the healthcare center at the community. So the idea with these types of communities is that a person may move in to the independent living, and as their healthcare needs change, they may eventually move to an assisted living setting within the community, memory care if there's changes in cognition and memory. If they fall and hurt themselves and need skilled nursing, they go into their healthcare center there, get some rehabilitation, and then potentially move back to the memory care, the assisted living, or the independent living. So it's giving the residents who buy into these communities, the options to have all their needs met within that particular community. These places are expensive. They usually do require a buy-in of some kind. And, it's oftentimes hundreds of thousands of dollars to buy in. And there are usually contracts involved with doing a buy-in. So it's not an option that's available to everybody, but it certainly is to folks who, have those financial resources to be able to identify these communities. So these are the other ones that are out there. So with regards to evaluating residential care, this is could be potentially a whole class on its own. And, what you see here on this slide is just a few of the boxes that we want you to be aware of and to check as you are looking at all the different types of residential care that are out there and trying to determine which is going to be the best fit, not only in terms of categories. So maybe I've identified, yes, memory care is what my mom needs. Now I need to look at the whole list of memory care in San Diego and figure out maybe one of the top 3 memory care facilities. So what we have, and you will be receiving when you get the email with our presentation, the slides from today's presentation with that email, we will send out a tip sheet for you that includes all these little check boxes and some other tips as well too, to give you just some perspective and some ideas in terms of what to be looking for when you are assessing what is out there and what is available. And by the way, I certainly would encourage families to call us at Alzheimer San Diego so that we can talk to you and give you perhaps some more specific ideas as to what to be looking for as you are researching both online and also doing some in-person checking, which we can now do. At this point with our vaccination here in California, we're able to go back into facilities and be visiting them. So what you'll see on this particular slide is some important websites for you to be aware of, to go to kind of further put that eye onto facilities with regards to assessing. How are they? Are they good? Are they, what's the word on them? The one at the top is the California Advocates for Nursing Home Reform. And we often refer to this organization as CANR. And they've got some really good information on their website. And I really encourage you to not just go to one of these websites, but go to all of them and then put that information you get at each of these websites together. California Department of Social Services is a good place to go to for information about those RCFEs, those residential care facilities for the elderly. And then the California Department of Public Health can also give you information about those SNFs, the skilled nursing facilities. ChooseWell is a really fantastic website that has a listing of assisted living facilities here in San Diego County. And again, I'm just going to reiterate that it's really important. There's, unfortunately, we have to do this kind of research to go to these different websites because there's not a one website that gives us all the information that we need. So it's really important to be methodical about this whole process. And again, we want you to know that you can call us because we do have these checklists for you. And we do also have the list of the memory care communities that are here in San Diego County so that you don't have to go searching for all those facilities. We've got that list. So we have done some of the work for you. You still have some work to do though, folks. And, for sure, it's very important. So I'm going to turn it back over to Amy, and she is going to talk about support services.
Great. Thank you, Jean. Yes, I'm going to talk a little bit about, Jean gave you a really nice overview of the range of the places themselves, the residential care options. Now I'm going to talk about the other types of support that's available if you're in this process, you're planning ahead for this process. So let's start first with what we call placement agencies. So as Jean indicated, if you were to call the Alzheimer San Diego office and ask to speak with a member of our clinical services team to get some ideas about your options with regard to residential care, we absolutely will send you the list of all of the local memory care resources. It's divided up geographically. We can provide you links to these organizations that we've mentioned here today in this program. But we as an organization aren't going to refer you. We're not going to make specific recommendations to a particular place. It's a complicated process. It's a complicated and very personal and individual question. We'll support you through it. We'll help you make that decision. But we don't actually make direct referrals to communities. There are options out there, however, for services that do this, and placement agencies are one such option. So these are private companies, they are businesses, they are free to you, the consumer. It doesn't cost you anything to work with a placement agency, but it is a private business, it's not free. What happens is they make their money by receiving referrals when people move into the buildings, right? So you would contract with a placement agency, and there are many good ones here in San Diego and elsewhere around the country. You contract with them, they get to know you. If they're a good agency, they do a very thorough assessment. They really get to know the resident. They see where the person really live, where they currently live, and try to get to know them and their needs as best they can. And then they make a set of recommendations. They make a set of direct referrals to some communities. And if the person moves in, then the community pays them the referral fee. So that's how it works. That's how, and a good one is going to be very open and transparent about this process. Some of them will only refer to places where they have contracts. There are some that will refer even when they don't have a contract, and they won't make a dime on that referral. There's a whole range of sort of models and services out there. So just want to sort of explain how that works. And if you need recommendations for placement agencies here in San Diego County, let us know. We can point you in that direction. There is another type of professional out there called a senior move manager. And there is an organization, a national organization called NASMM, the National Association of Senior Move Managers. This may seem like, why would we need a mover that's specific to the needs of seniors or older adults? But the reality is the stuff, right? What we're going to do with all of the things in this house, the emotion around the things, the emotion around getting rid of things or relocating things, resituating them in a new place, or just even like figuring out, we're moving from a 3-bedroom home into a 1-bedroom apartment. How much stuff do we even need? Senior move managers are experts that this is what they do for a living. Now they do charge, there is a fee for using their services, and they charge their clients directly for doing this. You can find one through the National Association of Senior Move Managers, and I do recommend working with folks who are members of that organization, sort of the major professional organization for people who do this work. But what they'll do, if you're working with an experienced local person, they know the community. So you say, we're moving into a 1-bedroom apartment at such and such facility. They know that community. And if they don't, they'll go there, they'll get the floor plan, they'll get to know the staff there. They can help you then go through the home and figure out what you need to bring, what's going to fit. They also understand life in an assisted living or memory care facility. And they know, we're not going to need 10 different dish towels. Right? We're going to have a dishwasher in this particular unit. They can really help sort of pare things down. And then they're very helpful with the sort of emotional process of paring down one's belongings. They can help with moving things, redistributing things to family members, getting them shipped, making charitable donations, getting them off to places that can use them or need them. A really terrific resource. They also, many of them will run estate sales if the family is not looking to keep all of the things. So this is really a nice resource. It does cost money though, but a nice resource for people where the things, the stuff, the house is the real sort of barrier to moving forward with placement. Professional organizers, this is sort of an ancillary service. They don't necessarily specialize in working with older adults or with people who are relocating, but I like to mention them as an additional resource for people who maybe don't need the services of a senior move manager, but would really benefit from having somebody help them kind of pare things down. So you can locate a professional organizer through the National Association of Productivity and Organizing Professionals, NAPO, NAPO.net. A good resource to be aware of if that would be helpful to you. And finally, aging life care professionals. These are often referred to as care managers. Aging life care professionals are private individuals, private professionals who contract with individual clients and their families to help them sort of navigate this whole, the healthcare and the long-term care system. So what they do is provide placement consultation, help with the relocation, and then sort of the coordination of whatever services are needed. So this is a little bit different from a placement agency in that it is not free to you as a client. They do charge, usually on an hourly basis, although some have flat rates for maybe a placement consultation service, but you are paying them out of pocket for their consultation and their advice, but they are making a specific recommendation for you. They are not accepting a referral fee from any agencies, services, facilities, communities where they might refer you. They're making a more objective evaluation. So the aging life care professional is another really helpful resource, not only for help with sort of figuring out the move itself, where should we go, what's the right level of care, what's a good place for me or for the person that I care for, but they can also kind of navigate the maze of resources for making it all happen. And then if you want them to, they can stay involved and kind of be an advocate, be a liaison. Particularly helpful if you're a long distance caregiver and you're helping somebody with a relocation in a city where you don't live, right? They can be a set of eyes and ears for the long distance caregiver. So you can find a referral to a care manager at the Aging Life Care Association website, aginglifecare.org. Or again, we do maintain a list of local care managers, aging life care professionals here in San Diego County. We maintain a list at the Alzheimer San Diego office, and our social work team, our clinical services team would be happy to point you in their direction. So with that, let's take any questions that have come in. Hi, Kristen.
Hi there. We've had some really good questions.
Great.
The first one I'd like to give to you is one of our participants has asked if persons with dementia can continue to stay in memory care when they reach the hospice stage.
Great. That's a really important question. And the answer is absolutely yes. Hospice services can be provided in any setting, in a private home, in a medical or a healthcare setting, or in a residential care setting, meaning assisted living or memory care. The community itself does have to have some sort of special permission to have the hospice there, but this is not a complicated, most of them already have it. And if they don't already have it, it's a very simple bit of paperwork for them to complete. So you just want to ask that. That is actually one of the things on the checklist that we'll be sending out. You want to ask how many sort of hospice beds are available within this community. That's just a matter of how many individual residents can you have at a time who are on hospice. Licensing does sort of set limits around that, but absolutely. And thank you for that great question. And I'll point you toward another resource in our webinar library. We have a program devoted to the topic of hospice and palliative care services in the webinar library. So if you want to know more about those resources for end of life or palliative care, you can watch that in the webinar library too.
I can put that link in the chat as well. Do we have time for another question?
Yeah, sure.
I'm actually curious about this one. So another participant has asked, shouldn't memory care facilities provide appropriate activities for memory care residents? And do we ever, as an organization, provide in-services to facilities on this topic?
Yes.
Nice.
Jean, would you like to take that one?
Well, I will, and you feel free to chime in. You know, I guess here's my answer is they should be providing some sort of activity program for the residents that are living in memory care. We know that is good for, I mean, it's good for all of us, whether we have a diagnosis of dementia or not. But most certainly, you know, our people living with dementia need kind of that oversight and supervision and that initiative to keep them engaged. And, you know, as Amy, I'm going to steal words from her, as she always says, you know, in some of our other programs is, you know, we have billions and billions and billions of brain cells. And so we do want to be stimulating and keeping those brain cells engaged in our residents living with dementia as much as possible. So yes, to have dedicated activity programs is very important. Does that happen all the time? Not all the time. It doesn't. And so it's really important to ask about, you know, what type of dedicated activity program do you have in this particular memory care facility? And what are examples of some of the activities you're doing with your residents with dementia? And if you can get some eyes on to actually see that, that's better, because I will just say, and I say this from years of experience, I worked in memory care myself in a care facility for 10 years. And by the way, actually in recreation therapy, so as an activity director assistant. You know, sometimes facilities put up schedules that say they are doing these things, and sometimes those things aren't happening. I'm sorry to say. Any good memory care facility has a dedicated activity program for their residents that is carried out. So, but ask your questions about that. Amy, what would you say?
Yeah, absolutely. This is why I pointed it toward Jean, because she has experience doing that herself. And this is one of the key differences, I would say, between your average board and care home and an assisted living or memory care community, is that because of this, not because of the quality of the care, but just because of the size and the scale of the place, they don't have, a board and care does not have a dedicated activities person. It's a good board and care. They're still going to run some activities for their residents, make things available to them, but they don't have a calendar, a schedule of activities programs. But to the larger question of should they? Absolutely. Should a good memory care community be running innovative, interesting, engaging, stimulating activities for people living with dementia? 100%. And do we offer in-services and training to them? Yes. I love that question too. All of our services at Alzheimer's San Diego are free to you, right? The public, the community. When we are asked to do training at private businesses, we do offer that training for a very nominal fee. It's very affordable. We have nonprofit rates. We have very low for-profit rates, but we can come in, we can either do these remotely via Zoom, or we can come in and do on-site hands-on training with the staff at communities to help them, you know, not only sort of learning symptom management and behavior and redirection, but we are often called in to help out with coming up with sort of activity and engagement ideas and planning. So absolutely, we can do this. We are a very small team here at Alzheimer's San Diego, so we don't reach out and offer this to everybody, but if you know of a community that you think would benefit from it, feel free to make the suggestion or reach out to us, and we can reach out. That is always a possibility, and we do offer that training. Yeah.
So are we gonna take
I
any
think
more?
so. Any other questions? Are we good?
Do we have time for another?
We can take one more, sure.
Wonderful. Someone has asked if their person is frequently combative, are there fewer options for a memory care facility, or does memory care typically cost more?
Oh, that's a really good question.
Yeah.
So combativeness in and of itself is not something that's going to keep somebody from moving into a memory care facility or being able to stay there. But if they are combative to the point that they're dangerous to the staff or to other residents, absolutely, this is going to limit their options. But a good community is definitely going to work with the resident, going to work with their family and with their healthcare providers to try to come up with some solutions, behavioral interventions, changing communication strategies, giving them more engaging activities to participate in, maybe even adjusting medications, right, to address agitation, combativeness. They're going to try to work with the person to keep them there. But absolutely, a community that is able to take care of people, to support people living with dementia who have more combative behaviors, they do tend to charge more because they have more staff, because they are generally larger communities that have more support and more resources available to deal with that. So yeah, that is, I mean, Jean, would you add anything there?
No, I just would agree with all of that, you know, a good facility is going to just take that time to work together with the family to try and figure out how, can we resolve the situation, because it's a quality of life issue for the person living with dementia. If a person is combative, it's because they're not happy. There's something going on. So what can we do to try and address this issue and keep the person safe and keep the other residents safe and the staff safe as well too. So it's, if you think it might be a concern with your person with dementia, if you've had a few incidences where they've been combative, have that dialogue in the sense of saying, what would you as a facility do if my person with dementia became combative? What would be the steps? How would you address it? How would you communicate that to me? What would be the next steps?
Thank you so much.
Thank you.
Good. Okay, so now we're going to get into the other meat area of things here with looking at residential placement, which is the financial considerations. And of course, we will all, I think, agree that this is very important. And so when we're talking about paying for long-term care, one of the most important things for everyone to understand and take away here today, if you did not know this already, is that Medicare and other forms of traditional health insurance do not pay for the costs of long-term care. So Medicare is not paying for, some of that care in the home, but additionally, Medicare is not paying for the board and care or the assisted living or the memory care. So where do we get the money to pay for these things? Well, for many people, for most people, we go into our own pockets to pay for the costs of long-term care. So we're accessing our own resources, our personal savings and assets. And as we say often with these particular care options classes, for many of us here in California, the resource that we have that we may be using to help pay for the costs of long-term care is our homes, the equity in our homes. And so for lots of people, which is many of us, just kind of middle-class people that maybe don't have really, really big retirement savings accounts, we are looking at accessing then some of that equity that is in our homes. So for many folks, I shouldn't maybe say many, for some folks that had the foresight to be able to kind of be looking ahead, they may have purchased long-term care insurance policies. And if you or your parents or the family member that you are caring for at this time was one of those people who had that foresight and has a long-term care insurance policy, good for them, and make sure that you use it. And so in order to use it, what you want to be doing, if you haven't already, is contacting whoever it was that issued the policy to get a benefits review, so you understand what is covered and how much is covered, what is the daily benefit that people are getting, and what do you need to do to kind of trigger the policy. And usually what that means is people need to pay out of pocket for a period of time before the policy will kick in. So make sure that you use these resources. I was talking with a family just about a week ago that they have a long-term care insurance policy, and the daughter is trying to help mom and dad do some navigating here with having some more care in the home. And, the costs of just paying for it out of pocket is not a possibility for them, but they have this policy and they may have these benefits to be able to bring some, get some additional care for their mom and dad. So you want to make sure you have a look at that and understand what exactly you purchased and what your benefits are, and figure out what it is you need to do to trigger it. The financial tools that are out there, and let me just start by saying I'm not a financial planner or an elder law attorney or an estate planner, so I am no expert in these areas. There are experts we can point you towards, and again, that's just a matter of contacting us at Alzheimer San Diego. There are financial tools that are available to people, and one of those is reverse mortgages, where again you're using the equity in your home to bring in some additional cash flow. There are different rules and regulations for reverse mortgages, of course, the primary one being that you have full intention of either staying in your home, or if you are in a care facility at this time, your intention is to return to your home. And so there are limitations in terms of what you are able to do with the increased cash flow through a reverse mortgage, but it can help. Charitable gift annuities are another way to access resources, where you may be giving a charity, you may be giving them your home, and upon your death, the charity will sell your home and have those funds donated to them. And in the meantime, that the charity is able to give you a percentage and a portion of the value of your home for you to be able to, again, bump up your cash flow to be able to pay for care. There are also converted life insurance options for people. And this is where you're able to flip a term policy to a permanent policy. And this may allow you to access the cash value of the policy to help pay for care. We're going to also talk about Medicaid here in just a moment, and VA benefits, which are other options certainly for some people to be able to pay for the costs of long-term care. Here we go. So we're going to start though with Medicare. And Medicare is our federal health insurance program that we pay into out of our Social Security deductions when we are working. And so long as we have met the requirements for that in terms of those Social Security deductions, we will qualify for Medicare at age 65 or younger if we apply for Social Security disability income and qualify for that. And this program is an entitlement program. So any people that have worked and paid those deductions can qualify for it. So it's not based on financial needs. So regardless of what kind of assets you have, in the bank, or, in terms of your assets and resources, whether you have lots or whether you have very little. If you've paid into the program through Social Security deductions, you qualify for Medicare at age 65 or again younger if it's a Social Security disability income situation. What does Medicare pay for? It pays for our medical care, seeing our doctors, and for hospitalizations, and for skilled nursing facility care in the case of rehabilitation, which I had mentioned earlier. If I go in the hospital and have a broken hip and have my surgery and get that hip taken care of, and then I need to go to a SNF, a skilled nursing facility for rehabilitation, Medicare will pay for a cost of that for a period of time. And Medicare can pay for some home health care. Again, if then maybe I am discharged home from the skilled nursing facility, but I still need a little bit of home health care with maybe a dressing change or some physical therapy or whatever it might be, Medicare can cover the cost of that. So we have some great experts in the areas of Medicare and that we can point you towards. And again, please feel free to contact us at Alzheimer San Diego. There are some programs that are devoted to giving you folks any of us as consumers of Medicare and users of Medicare, giving us good information and guidance in terms of the questions that we have, and even looking at open enrollment and some of those kind of things. These folks can give us some good guidance. So next we talk about Medicaid, and here in California we call this Medi-Cal. In the rest of the states of the United States, it is called Medicaid. This is a need-based program, and it is funded jointly with both state and federal funds. And it is managed by the state itself. So here in California, we call it Medi-Cal. Our requirements to qualify for Medi-Cal are pretty generous here in California. And that's not always the case in other states. And so what we have seen with regards to this is that, although it is a need-based program, sometimes the perspective is that it's only for people who, really don't have anything at all in terms of assets or resources, or you have to get rid of everything in order to qualify for Medi-Cal. And that's not the case. Now, again, I'm just going to say I'm not the financial expert in this area, but we have some great people that we can send you towards for information within the realm of Medi-Cal planning. And it really is a program that can be very useful to those of us that are in the middle class to help prevent us from becoming destitute as we are looking ahead with the costs of paying for care. And, if my husband and I are getting older and he has dementia and he needs to be in a care facility, and all we have is our house here, and I can't sell it, well, then where am I going to live? Because he's living in the facility. Medi-Cal planning is probably something that is a good option for me to explore with the good advice of an elder law attorney, so that we can qualify for Medi-Cal and get that help that we need. Medi-Cal can help in a variety of different areas, and one of them is through in-home supportive services and the community-based adult services. These we talked about last week in last week's Care Options program. And if you have questions about those areas, you can either go back to our webinar library and have a look at the webinar from last week, or give us a call at Alzheimer San Diego. Medi-Cal can also be used for these skilled nursing facilities, the SNFs that we've been talking about today. So again, if my husband and I qualify and he needs care with his ADLs, but he's also at a skilled nursing level of care with his dementia and his other health situations going on, then Medi-Cal will cover the cost of that SNF care for him, that skilled nursing care for him. And I can, remain in my home, and we can keep this asset as as I am growing older and he is needing the care he needs. We actually have another program here in California that is the Assisted Living Waiver Program. And I'm just going to make brief mention of this. This has been a pilot program being tested out by the government to assess whether it is, financially feasible and a good idea. In addition to care-wise, is it a good idea to allow Medi-Cal to cover the cost of care for people in an assisted living setting versus a skilled nursing facility setting. And as I have said before, myself, Amy, Kristen, I think every health professional that has anything to do with these types of care situations, settings, and facilities, we all can tell you unequivocally that to have Medi-Cal pay for the cost of care in an assisted living setting would be fantastic, and it would cost the government and these programs a lot less money. And it would be a better setting actually for many, many residents. And of course, the government takes their time in assessing these programs, and that is what they are still doing with this particular waiver program. So although we know it's great and would have many positives for many people, we're still not at the point where it is, an open program for people. It's still being tested out and assessed. And so at this point in time, if you want more information, give us a call. We can give you more information. Our understanding overall is that there is a waiting list for this particular program right now to be able to qualify for it and actually get into one of the facilities that Medi-Cal is working with in testing the program. So hopefully that's something that in the hopefully not too distant future, we're able to really talk about a lot more, and that it is a real option for many of us who fall into this area of being middle-class people who are going to need some help in paying for the costs of care. We have next, I'm trying to advance my slides. There we go. Veterans benefits. And so, of course, veterans benefits involves several different areas and programs, and certainly it involves health insurance for medical care for people who are veterans. And it also provides for service-connected disability income for folks. There are the pension benefits, which are the traditional ones. And then there's a really important program to be aware of, which is non-service connected, and it is the aid and attendance program. And if you haven't heard of this program's been around actually now for a while, but it was kind of under the radar for a period of time until maybe about the last, I'm going to say 10-ish years, that, we've it's gotten more promotion and more kind of word of mouth information being distributed about it. And so this is a benefit that is provided to veterans or veteran spouses or surviving spouses. And it is, again, for people who need financial help to pay for the costs of care, potentially for in-home care, but also for an assisted living facility or a nursing home. And it's not service connected. And to be eligible for it, the veteran or the veteran's surviving spouse may be eligible if the veteran was discharged from a branch of the United States Armed Forces under, conditions that it was not a dishonorable discharge. And they served 90 days of continuous military service, active duty, with at least 1 day during one of our wars. So the wartime periods being World War I, World War II, the Korean War, the Vietnam War, the Persian Gulf War. So there was no dishonorable discharge, 90 days of continuous medical service, active duty, with at least 1 day during a wartime period. People did not have to serve in combat to be able to qualify for this program. And so then it does help pay for the costs of care in an assisted living facility or a skilled nursing facility. And again, sometimes in home care. The VA also offers a really terrific caregiver support program that can help pay for some of these things we talked about last week, which includes the adult day health cares, the CBAS programs that we talked about. Same thing, there's all these funny language and terms that we use. And then the homemaker and home health aid program, and for temporary respite placement in a care facility, so that a care partner can take a break. So all this financial planning is complicated, to be sure, and it's complicated for me too, folks. And so we really want to connect you with the experts to talk about your specific situations and to have your questions answered. So we do invite you to visit our webinar library to see the Legal and Financial Basics program. We just had one, I think, about 3 weeks ago. So it is fresh and new. Have a look at that. And again, as always, Kristen has put out the follow-up form in chat, so that if you want more information on legal and financial issues, questions, contact us. We have tip sheets or we have resource lists of elder law attorneys that we can send out to you for you to be able to follow up with regards to specific questions about your situation. So now I think, are we going to stop and?
Nope, I'm going to talk about resources and support now.
Oh, of course you are. I'm so sorry. I thought we were going to stop for a moment.
Nope. Here we go. So in this final section of the webinar here, we're just going to sort of talk about, you've taken in all the information, you have the resources, you have the details about what all of these levels of care are, who they're for, what they do, when is it actually time, and how do we sort of take that next step. So that's what we will wrap up by discussing here. Starting this conversation is never easy. And again, I want to, as Jean has, and as I already have, I want to again point you toward our team at Alzheimer's San Diego, who can help facilitate this. But start by getting the right people at the metaphorical table. You may not be able to sit around the same physical table to have this discussion, but make sure that the members of the family or the friends, the natural support system who need to be a part of the decision-making process, who need to have buy-in, that they are on board, that they are a part of the decision-making. That's what we mean when we say get those right people to the table. as Jean said at the beginning of the webinar, it's such an important point. Start exploring your options right now, wherever you are in this process. If this is not even something you think you might ever need, or it's something that you need in the very near future, we really recommend getting to know the different communities that are in the neighborhoods, in the parts of the county or the town, wherever you're looking, that are within your price point, right? You have to assess what your financial resources are. Get to know those resources now. Even if something should change, it's going to be maybe months or years before you need these resources. Having done the legwork now, if you can, to get to know the in-home care providers, to visit some adult day programs, to pop in on some board and care homes or assisted living or memory care communities, or even skilled nursing facilities. If you're thinking that the Medi-Cal route is the way you're going to go, get to know them now, get familiar with the landscape and the terminology, so that you won't find yourself making one of these decisions blindly in the midst of a crisis. So connect to us here at Alzheimer San Diego, or find other local resources if you're looking for something that's out of town. And I'll mention too, we have, I'm always referencing other webinars that are in our library. We do have a program on the topic of long distance caregiving. If you need to find resources in another part of the country, we have information about how to do that in that program. A short conversation here about talking to the person who's living with dementia about the placement itself. This is another area where we get a lot of questions, and families and support systems obviously need a lot of support around this. Should I tell him or her? Should I involve him or her in the decision-making process, visiting communities? It really depends on the person. We generally recommend, now there are lots of individual decisions and individual factors that would affect this, but we generally recommend sort of talking about it as little as possible, because for the most part, by the time you've reached the point where you're making a decision about placement, you're making choices about assisted living or memory care in particular with a person who's living with a progressive type of dementia. By the time you're there in the journey, in the spectrum, the person does not have a good level of insight into their disease, into their needs, into their declining abilities. And you're going to have a very hard time convincing them that this is something that they need or that you need in terms of respite. It's a very personal decision. You have to take into account their situation, their amount of insight into their needs, and their ability to participate in a decision like that. But if you are engaging someone in a conversation about placement, just be prepared. They're very likely to disagree with you that they need it, very likely to feel resistant to the community that you choose. This is absolutely to be expected and does not mean that the placement was a failure, right? If they're not happy that they have moved there, that doesn't mean that you chose the wrong spot, right? So do your research, get organized before you have this conversation, instead of just sort of generally saying, I think it's time that we explore assisted living or memory care. You don't want to bring that up until you've already done some research and you know what's possible and you know what's out there, so you can talk in specifics instead of these sort of broad abstractions. In visiting the communities, I generally wouldn't recommend bringing the person living with dementia along to visit, again, unless that really meets their specific needs or your specific needs. Not generally something that we recommend for all of the reasons already discussed. And when it comes to talking about the move, talking about the placement, as with other types of communication techniques that we teach here at Alzheimer San Diego, do your best to try not to engage in a negotiation, a discussion, right? This often just leads to a sort of unwinnable tug of war. Instead, we recommend using very positive, action-oriented language about, let's go, right? Today's the day, or, not using as little language as possible. If you don't need to talk about it, don't talk about it. So here again, I will refer you on to our communication skills class if that particular webinar would be of use to you. We do give examples of some of this positive action-oriented language, but generally it's kind of like the less said, the better in most cases. So a really important point here, when it comes to placement, many of us have been asked to make promises, pledges, don't ever put me in one of those places, right? That's an understandable ask that many people have. It is a promise that most of us can't keep and that many of us shouldn't keep. There are a lot of very positive reasons to place somebody in residential care. It's not a last resort. For many people, the relationship between the care partner and the person living with dementia improves dramatically after the person has moved into residential care. They're getting more of their needs met, and you can sort of go back to having your parent-child relationship, your spouse or partner relationship, your friendship, whatever that might be. So yes, in a way, I'm sort of giving you permission to break a promise if you've already made it, and to try not to sort of get yourself stuck in making such a promise in the future. A few super quick tips on making a smooth adjustment. Here again, I'll point you toward our webinar library for a program that's called After the Move to Memory Care, where we focus on this specifically, making a smooth adjustment. Be very active in the community's assessment process. Give them as much information, personal information about the person and their history, their preferences, as you possibly can. This gets them off to a really good start, allows them to provide really person-oriented care and services. Get to know the staff, the night staff too. Get to know that administrator, establish those relationships. They want to get to know you. They want to not only know, sort of who to contact in an emergency, but they want to understand your relationship with them, and they want to build a relationship with you as well. Do get to know the other residents and the other care partners. They can be great sources of support and connection, both for you and for your loved one once they have moved into the community. On the day of, and also in coordinating future visits, work with the staff to sort of coordinate what time you're going to come, how you're going to depart. They can be super helpful in providing distraction. Oh, come with me. We have your favorite music program is starting, or allowing you to sort of quietly slip away if departures are hard for the person saying goodbye, or if they're hard for you, right? So work with the staff. They will help you coordinate this. This is to everyone's benefit, right? To work with you to make that as positive as they can. And just be sure that you've got someone outside of all of this that you can reach out to for personal support. And this is a big part of what we do at Alzheimer's San Diego, connecting you to a support group if you are in need of that. Reaching out to one of our dementia experts. Jean and Kristen are just two of our incredible team of clinical services on our clinical services team who are here to answer questions, provide you with support, or just sort of walk you through a hard decision or a really hard day. You don't even have to have a specific need, just reach out. We're here for that support. Lots of education, other education opportunities. Obviously, we've been referencing many of the items that are in our webinar library. We can send you all manner of tip sheets and resources and information. We have volunteers that provide a great deal of companionship, check-in, and social support to people who are living with dementia. And again, if it's something that we don't do at Alzheimer's San Diego, we know someone who does it, and we'll be happy to connect you to any number of our partners out there in the community. So lots of good information on our website. You can reach out to us by phone, send us an email to info@alzsd.org, live chat us from our website, or fill out that request form that Kristen has sent out in the chat. We would be more than happy to reach out and follow up with whatever it is that you need. So just a couple of notes on some upcoming programs. Driving and memory loss, a big controversial topic for a lot of people, a difficult point of conversation. I'm going to be doing this program in partnership with our friends at Elder Help next week. As always, free and open to anybody. And then on Tuesday, July 20th, Jean and I will be facilitating what's called a drop-in education hour just an hour on a late Tuesday afternoon. You can pop in. You don't have to have a specific question, but if you do, bring it. And we're happy to just sort of spend some time seeing what's on your mind and answering your questions. So this is a great resource if you've gone and watched some of those recordings in the webinar library and it brought up some questions. Please feel free to bring those to us and we'll do our best to answer. So with that, we're going to go ahead and wrap up here. When this webinar closes, you'll get a link to a short survey. We'd really appreciate you taking just a minute. It's anonymous and it's quick to tell us if this was helpful and how we might improve it. Other ideas, topics that you are in need of learning about. We'd love to hear that from you. And a reminder that we have been recording this program and we will send out a link to our webinar library as well as a copy of these slides and that placement checklist that Jean referenced a bit ago. So my thanks to Jean and to Kristen for your help and your support here today. And also to Mona, our tech team volunteer, who I think had to log off a little bit early, but we appreciated having her with us here today. My thanks to all of you for being here. I'm always glad to see you, to have you with us. Thank you for your great questions. Kristen, you did a great job answering a wide range of questions in there, as always. And we hope to see you all again soon.